And how much improvement have you seen so far?
I almost feel new. If I compare with the first time, not the first time, before
You
came
in
here the first time, because I couldn't sleep for 6 weeks. And the first time that you give me the therapy, immediately first night I started sleeping.
Okay, hi Luis, how you doing today?
Okay, I feel better, yeah.
Okay, so Luis came into us with sciatica, a really bad case of it. He couldn't sleep for 6 weeks. Came in, and I think today we're on visit five today.
Yeah.
So, and how much improvement have you seen so far?
I almost feel new. If I compare with the first time, not the first time, before
you
came
in
here the first time, because I couldn't sleep for 6 weeks. And the first time that you give me the therapy, immediately first night I started sleeping.
Better, okay.
Yeah, I think I'm gonna get crazy because many days that I couldn't sleep.
Yeah.
And the first day I sleep well.
That's great. And we're on visit 5 here, so you're still having a little bit of pain in the middle of the thigh, and we're doing COX Flexion distraction technique as well as cold laser therapy to help him. But I'm going to show you a great stretch for sciatica using a lacrosse ball. Okay, so we're going to use this ball, and you know how to do it. Go ahead and get started. You're going to put it right behind the glute there, yep, and just roll it in there. Make sure you take your wallet out of your pocket, and as you can see, he's doing the salsa merengue dance there. Just rolling that ball around in the glute medius, glute maximus, also the piriformis muscle. And the further you move your feet away from the wall, the more pressure will be on the ball. So I have him do this for a couple minutes, and don't overdo this, because if you do this for 10 minutes the first time, you are gonna be sore the next day. So go easy the first time, break it in slowly. It's like getting a deep tissue massage or a medical massage in one area here. If you could just move your arms up, Luis, for me. Good, so people can see there, the ball right there. You can also use it for your lower back, but this is a great sciatic stretch. Obviously, he's doing it on the affected leg side. So now we're gonna show you how we do COX Flexion distraction technique for sciatica and cold laser therapy. Okay, we just put Luis on 15 minutes of moist heat and spinal decompression at 90 pounds of distraction force. So we're able to, with this computer right over here, set it to whatever force we may need to decompress the lower spine. So we're gonna go ahead and treat him with a little bit of cold laser therapy right over the sciatic nerve root. Okay. So we actually now have these lasers for rent and even to buy, to purchase. Not this particular one, this one's expensive, but we do have some other lasers that are really reasonably priced and very effective. So we're gonna go ahead and just laser right over the sciatic nerve, which comes from L4, L5, L5, S1, S1, S2, S3, and comes down into the butt area right here in the piriformis region to form the sciatic nerve, which is about as thick as my thumb. And this laser is just going to calm any inflammation down. It's going to inhibit the nerve. And typically I would do right here, right at the L5, L4, L5, S1 nerve root, right over the piriformis, right at the bottom of the butt fold here, right in the middle of the thigh where he's still having a little bit of pain at night, you said, right?
Yeah.
Okay. And then right above the knee, right before the sciatic nerve bifurcates. So because he has genes, I'll show you it, but we're going to have him put shorts on and we'll show you the areas that we want to target. Okay. How you doing there, okay?
Yeah.
And you don't feel much with this laser. We're going to do about a minute in each spot here, okay? It's going to take about 5 minutes total. I'm going to give you some shorts to put on. Now going over S1, S2, and S3. In most cases of sciatica do not require any surgery. There's only about 2% of cases require surgery, and we do not use cold laser on all cases, but the cold laser helps you get through it much faster. Probably about 50% faster than if you were to do it without cold laser therapy. Okay. Sorry, can't watch this part. We're gonna put some shorts on and then we'll show you the other points that we laser along the sciatic nerve pathway. Alright, so we just did over the nerve roots of L4, L5, S1, S2, and we also did S3. So now, and then we did over the piriformis muscle and a few other spots here. We're going to do right here where the sciatic nerve passes through. That's right where the butt and the thigh meet, the butt fold right there. That's the spot you want to do it. And if you have a saggy butt fold, then you might want to do it, just cheat it up an inch, half inch, depending on how saggy you are back there, if you know what I mean, okay? So you want to make sure you get right in that nerve there, and sometimes it feels like it's the attachment of where the hamstring is. We're going to do another spot right here in the middle of the thigh, and then right up above the knee, an inch above the knee before the sciatic nerve bifurcates. And again, for this laser, we're just doing it for 60 seconds. Just depends on the laser. Some lasers you might need to do it for 2 minutes, some for 3 or 4 minutes. Every laser has different strengths and uses different laser diodes, so there's a lot of variations as to how long you should put it on. So just because I'm saying a minute here doesn't mean if you have a laser at home that you should be doing it for just a minute also, okay? Then we're going to move down to the middle of the thigh. Then what we want to do is check where the knee bends. So right here, drop your knee down, or your leg down, foot, yeah. And that's where it folds, right where my finger is. So we're going to go an inch above that to an inch and a half. Now the rental lasers we have, you would hold it in this spot for 2 to 3 minutes, whereas this is 60 to 90 seconds because it's a 50 watt laser. The rentals that we have and the purchase lasers are 15 watt So the treatment times are a little bit longer. We got about 20 seconds here, and then we're going to go ahead and start the flexion distraction technique. Do you have any pain in this spot also? Or is it higher up here?
A little, yeah, down there too, little, like my knee.
Into the knee? Okay. And then the last spot we're going to do, especially if it goes all the way down to the knee or past the knee, is right here in the middle of the calf. And this spot, since it doesn't go past the calf or past the knee, we're just going to do 30 seconds on this spot. And we're going to strap them in. Now, when somebody first comes in the office and has sciatica, we don't strap them in. We have to tolerance test them first and make sure there's not going to be any problems putting them in flexion distraction. Okay. As you can see here, flexion distraction, COX Flexion distraction, is very gentle. This particular table is a hill flexion distraction table. We do have a COX 8 table next door, and it works very similarly. Any pain down your leg, Luis?
No.
Good. Now, we're probably dealing with a disc herniation or a disc bulge here, and we have not run an MRI on him yet. I don't need to do this technique, but that's most likely what we're dealing with here. MRIs are expensive, and a lot of times insurance companies don't want to pay for them. So, you know, if this comes back or persists, then we would go ahead and send Luis out for an MRI. But so far, he's on his 5th visit, and he's had what would you say, 50, 60, 70, 80% improvement? Where are you at now?
Now, I think 90.
90% improvement?
Yeah.
So in this situation, we don't need to send him out for an MRI. But if it comes back again, or if I see him next year and it comes back with a vengeance, or, you know, or he has another flare-up anytime sooner, we may at that point refer him out for an MRI just to take a closer look to see what's going on with the discs in his lumbar spine. So we do a little flexion distraction, and then we go ahead and loosen the muscles up here. down here. Any pain into the legs?
No.
Good. You can see here it's this gentle pumping action right here that helps to suck some of the disc material back in like a vacuum into its space, and also take pressure off the sciatic nerve. And this is what's alleviating his pain. This simple motion here, and then obviously, you know, alleviating the muscle spasms and inflammation in the lower back as well with laser. No surgery needed here. Again, only 2% of sciatic cases require surgery. A lot of times people go to a physical therapist for sciatica. Sorry, but that's the wrong place for sciatica. It's good to strengthen the core with physical therapy after you go through sciatica, but initially you want to see a chiropractor, remove pressure off the sciatic nerve, and then after 4 to 8 weeks, 4 to 10 weeks, sometimes longer in some severe cases, you would then do physical therapy to strengthen the core so this doesn't reoccur again. And we're going to get him into stretching and exercise and physical therapy real soon. Again, this is his 5th visit, and we've already started with the stretches as you saw in this video. So let's go ahead and have you take a deep breath in for me, Luis. Good, and blow out. Keep your legs straight. Raise one leg as high as you can. Good, and down. The other one. Okay, is one leg harder to raise than the other? How's that feel?
Good.
Yeah, they both went up evenly there. So that looked good. Okay, turn over on your back. And hands up in the air. Okay, so you can see here from his arm, see where my thumbs are right here? You can see here, if you zoom in, that this arm is shorter. And it's not because he has a shoulder injury, it's because of his psoas muscle. It's tight. The only way to get to the psoas muscle is through the front here. Tender in there? A little bit, yeah? Mm-hmm. How about over here? Yeah. Okay. And take a deep breath in. Good, and blow out. Like I said, the only way to get to the psoas muscle is through the stomach. Really important to check this. This muscle is a forward and lateral bender of the upper torso and of the hips. It's a hip flexor. It's attached to the lumbar spine, to the low back, the side of the spine. And watch as I check his arms again after this. Go ahead. Watch this. Now look at that. See the difference? Now it's balanced. Incredible. Just from releasing the psoas. Has nothing to do with the shoulder. Relax there. And relax here. Okay, you're all set.
Okay.
All right, I'm gonna let you get changed. And folks, thanks for tuning in.